Mic check. Check. Mic check. Can you hear me, Keith?
Yes, I can. Thank you.
How you doing today?
Good. How are you?
Doing very well, thank you. Mic check. Handheld.
Okay.
Who's the gentleman that's going to be speaking? Mic check.
Henry Colin?
Check. Mic check.
Is
Can you hear me, Keith?
Yes, I can.
I think he mentioned he probably doesn't have a PowerPoint or.
I think that's probably the case.
Okay.
Tell him if he does, get here by 11:30
Okay.
to give it to us. If he's not going to send it by email, which he didn't.
Do you know if he will have anything to show on the screens? Do we want to turn them on and just in
Put our
case?
logo or something, or your logo. No, I don't know that. Hopefully he has like his business card or something.
Okay.
People know he's speaking. Yeah, because they're going to see the picture of him and then the screen. So
Yeah. So right now it's just the background. So yeah, I'll probably just pull up like it's just my LSU background. So I'll probably just pull up put the logo there in case
Yeah.
it doesn't have anything.
Or if you could put our logo.
Yeah. Yeah. I'll put your logo
Yeah.
on there.
Okay, great. And I love Lifepro too, but. Well, we have to probably be careful. He's talking about insurance. We don't want people to think it's Lifepro speaking.
That's true.
That would get us in trouble. You promised what? And the webcast people love, but it's killing our in-person attendance.
Yeah, that'll happen. It's a lot easier to just tune in.
We did not realize that it would be this dramatic. I mean, we went from having not enough space at our location to a beautiful room here with space, and then as people got used to the webcast, it's just slower and lower and lower and lower.
Yeah, I remember the first couple, like there was tons of people here.
Yeah.
Yeah, just.
Now it's me and the speaker. Let's see, I got to text the boss here. I don't know that he's coming in person, but I need something from him. I've been sending out reminders all morning. Trying to get some people on site. And they got an email blast.
Have this
Perfect.
up if.
Yeah, if nothing else, perfect. Thank you.
Actually, I'm gonna forward the notes from Mr. Z. I've got a copy of it already, but. started sooner rather than later, just in case there's any hiccups or anything.
Oh, no, yeah, I'm okay. It was like, we're up here walking around talking, and then James says, okay, 15 seconds, and then we go, and that's on the...
I can go back and edit those.
Oh,
so
can you
I'll go
easily?
in. Yeah.
Oh,
YouTube
embarrassing.
has like a nice, easy like web editor where you just kind of drag it and tell it where
Can
you want
we
it to
do
start.
that?
I believe so. I'll.
I have the,
I think you have the login for that, right? If not, I'll email it to you.
probably in some email from
Okay.
way back.
I'll email it to you again, and also
A link to the
kind
web
of like,
editor?
yeah, I think it's right on there, and I'll give you some instructions
We
on that.
get a class.
Yeah.
Because we don't want to burden you guys.
It's no
Well,
trouble
we
at all.
need to learn it. but
Love
it's like,
to help out.
oh, no, thanks.
Nice that we can.
People love the webcasts. I mean, they play them and they play them. I mean, our count isn't hitting 1 million.
Yeah.
If we get over 50, to me, that's a pretty good number.
Yeah, I think the last one, last month's was, I think like 56 or something
It
I
was
saw
growing.
there.
It was
Yeah, and it'll
growing.
keep going, I'm sure.
Yeah. Because then we send people the links. They have a question about this. Oh, well.
And what we could
Here's
actually
the
do
webcast.
is create I think it's probably already there, but like a channel where it just lists all of them, so they don't have to have the link directly to it.
Yeah.
And then you could put that on the website and things,
Yeah, that's what
things
I
like
send
that.
people the channel and then the specific one that they're looking for because some people are technically challenged.
Yeah.
They get to the channel, they can't find the one. It's like, all right, I'll just send you both.
Yeah, better safe than sorry.
Yeah. All right, Henry, you son of a gun. Leave me high and dry here.
Yeah, maybe you'll be giving the presentation today.
I got a yacht, no water. Let's see if he's lost. But he's been here before. Remember 120?
I am not sure about that. This is 110, but I'm not sure which one of these is 120. That's up there.
we do PDF file?
Yes, sir.
Yeah?
Yep. Pull that up.
That's off the website.
It's
Download it.
on the site somewhere.
Oh,
Can
yeah.
you-
Is
yeah,
that
I'll just
easier?
download it from the
Okay, cool.
website here. Yep. Where is that on here?
Let me drive. 'Cause I don't know. Let's see. I found the quickest down here.
breast pocket, belt. Just get this guy.
Okay.
All right.
Testing. 1, 2, 3. They can hear me? Okay.
YouTube.
So I can go off of this now myself, right?
Yes. You can go off of that. And this will.
Okay.
Yep, sounds good.
Keith Miller. All right. You know which building to go into from last time? I mean, it should be the address we gave you. Do you remember the conference room we were at? Oh, I thought we had you on webcast here. All right, so 14. Well, if you're in the building, you're in the wrong building. Come across the courtyard.
My mic's on.
Oh.
So I'll just turn that off for the.
So it's about time.
Yep, we got noon right on the button.
All right, you go ahead and start it while you wire it in. I'll do the directions if that's.
Did you get that thing?
I put it back on now.
And this can.
Okay, we're live, so he's gonna wire you up. I'm gonna do intros.
How you doing?
Right.
Ned.
Henry, pleasure.
Nice to meet you.
Yeah.
All right, so let's get this guy on here. This can go wherever's most comfortable for you. Pocket, breast pocket, belts.
Yeah, I guess I'll put him on breast pocket.
Okay. Should I start?
Oh yeah, we're going.
We're go. Good afternoon. Thank you for joining us. This is the ALS Association Greater San Diego Chapter Care Services meeting. You'll see on the presentation understanding your benefits when you have ALS. So there is a resource guide that addresses this topic. And we have a guest speaker here today to talk to us. So I'll ask Henry to come up, introduce himself, and start the program.
Thank you, Keith.
You're welcome.
Thank you. Hello, everybody. My name is Henry Colin, and I am a financial insurance consultant, and I've been working with the ALS Foundation for, about 8 to 10 years now, Keith?
11 years?
Yeah, maybe that, a little longer. So I don't know how this works. This is my first webcast. So we're going to go ahead and I guess we take questions, or how does this work?
Well, you can start us right off with understanding insurance and benefits for you ALS. So take us from a person who's just been diagnosed. What are the questions they should be asking? What are their options?
Certainly. Now, again, working with the PALS, people with ALS, for the past years, I come across many families afflicted with this illness. So one thing that you need to understand is once the illness is diagnosed, there are some qualifying events. Excuse me, those qualifying events, you'll be able to get fast-tracked onto Medicare, SSI, and things of that nature. So we'll start with maybe Medicare. So let's say somebody is diagnosed and it's after age 64. or if they're already on Medicare, so they have either Part A or Part B, or those that are Medicare eligible, signing on to Medicare. Part A and Part B is what you're going to need to sign up for. Now, Medicare is a whole different beast on its own, and it's very confusing. But there's a lot of information, especially on the website Medicare.gov. So if one goes to Medicare.gov, it'll explain everything that, well, most everything as far as Medicare benefits are involved. Now, one, you got to ask basically when you go to sign up to the SSI as far as qualifying events. So qualifying events to sign on to Medicare, even if you're under age 64, you're going to be able to qualify. One is kidney failure, the other one is ALS. So those in particular illnesses, you'll be fast-tracked onto Medicare. So they're going to ask for the information, diagnoses from the doctors or neurologists and whatnot. Once you have all that paperwork, basically you take it down to the SSI office and start your enrollment. Now it's going to take anywhere from maybe 30 to 90 days, but once you receive your Part A, you're going to have to sign on to Part B. So that's Medicare, that's the federal health system. That's one's health insurance by virtue of paying taxes. So if you paid into taxes working for over 10 years, then you're eligible for Medicare. Sometimes you'll have a share cost, but everybody's case will be different. Now, once that's involved and you're signed on to Medicare, there's a Part C. So there's many parts, like I said earlier. It's a different beast, and there's a lot of information. So I'm just going to touch up on some bullet points from Part A to Part D. That way you get familiarized with Medicare. So once you have Part A and Part B, Part C comes into play. And what Part C is basically what they call MAPD plans, Medicare Advantage Prescription Drug Plans. Now, with that said, you'll be able to sign on to products that insurance carriers such as, let's say, Aetna, Scan, Anthem, Blue Cross offer. And especially right now, since the open enrollment is coming on, people will start getting promotional brochures and whatnot as far as signing on to a Part C plan. Part C plans are basically Medicare Advantage prescription drug plans. So instead of just having Medicare Part A and Part B, you can sign on to a Part C plan and not worry about the whole deductibles and the 80-20 plan. Now, Medicare alone is an 80-20 plan where Part A is hospitals and Part B is outpatient surgeries and some medical. But you really, if you don't want just regular Part A and Part B, you have the option to sign on to Part C. There's a lot of information, but again, we have a limited time here. I could be here for a while. But Medicare.gov, again, is a good website to get familiarized with Medicare. But going back onto Part C plans are Medicare eligible plans for those on Medicare, and those plans are just as equal or better than the Medicare. Well, I can't say better. They're basically, it's the same federal model that the government uses to provide the health care to those recipients on Medicare. So Part C plans such as Scan, Aetna, Anthem, and whatnot, those insurance carriers offer these MAPD plans for those individuals. Now, every plan is different, and depending on county or where you reside, you might have a different plan in San Diego County. Obviously, you will have a different plan if you're in San Diego County versus Los Angeles County. So try to get familiarized with Medicare. If you don't need to know the whole thing, but Medicare.gov is a good website to go on. Some of those that are enlisting onto Medicare this year in the annual election period, you'll be receiving a Medicare booklet, or maybe you already received it. That alone has the information that you'll be looking for. Now, For those that have benefits through an employer sponsored plans such as health care, supplemental, life insurance, you want to talk to the person in HR that can guide you along the way and see what benefits you're eligible for when you're diagnosed with a certain illness. Let's say some have short-term disability plans, long-term disability plans. You want to look into those benefits as well. A lot of us, when we sign on to the employer-sponsored plans, healthcare plans, benefit plans, we quickly just go ahead and sign on for, let's say, healthcare and a supplemental and some life insurance, and we really don't, get involved in too much of what the benefits are. So if you haven't, maybe you want to sit down with HR or a broker that offers basically those services, such as myself. People have been calling me throughout the years, and I'm more than happy to visit with them at their home, discuss their options over the phone. But for those that have health benefits in their health insurance portfolio, please look into talking with the Human Resources Department or the brokers that they use or agencies for their health insurance benefits. So a lot of things, go ahead.
So what if I'm still working and I don't want to share my diagnosis with my employer?
You have that right not to share, but if you have a short-term disability plan or long-term disability plan, that will eventually come out. So if one's diagnosed, you can, let me go back. If one's diagnosed and the illness is progressing quite rapidly, then it will be known to your employer, but that doesn't mean that they're going to take you off the plan. So you'll be able to get your benefits as far as, let's say, short-term disability. You'll be on your short-term disability plan for anywhere from 12 months up to 24 months, depending on which benefits you signed on to. So you don't have to share it, but in essence, if the progression is quite rapidly, it will be known, and it's a confidentiality. So other than you and your employer will know. People have shared with their co-workers and whatnot, but again, it's something that it won't be used against you. Now, I do have a case right now where this individual is diagnosed, and the carrier is taking a little bit longer to pay out the benefits. Again, this person has another party that's basically their administrator. So there's always going to be some loopholes where an insurance carrier is going to obviously use it just to, make sure that that person is a person. So when you have a third-party administrator, such as an estate or trustee, it tends to be a little bit more involved. But they need to verify the person is who he is or who she is, and then from there start with the benefits. But again, those benefits you are entitled to. You signed on to them. You've been paying on them. So please look into getting those benefits activated. Now, another thing is life insurance. If you have it through work or you have it on an individual basis, whole life or term life, you want to look into your policy, because there's a provision there on most life insurance policies where it's called an accelerated death benefit. So in the event that the person's diagnosed with an illness, terminal illness, and has less than 1 year of life, then you can get half of your life insurance benefit. So let's say a person has $100,000 and doctor diagnosed and it's terminal and has less than a year to live, then that is sent to those notes are sent to the life insurance company, and then from there they'll do their due diligence, and if you want half of the insurance that's on you, then you can do so. A many people in the past 2 years I've been finding out they didn't know that provision was there, but most life insurance carriers do offer it, and some of the pals have in the past activated that. Now, another thing, veterans benefits. I mean, veterans benefits are not too in tune, but as far as veterans benefits go, you have your veterans benefits, you have your regular Medicare as well. Again, we have many benefits as far as the veterans go, even and comparing to the people with employer-sponsored plans. So you want to sit and look at your policies and read them. That way you know exactly what you have, but you have options. You always have options. So you're not going to be, let's say, crawling through the walls and looking for answers. I mean, you have the Veteran Benefits Affairs that can help you out. You have your HR department that can help you out. And you also have some brokers and agents like myself that are willing to lend a hand. So it's a tough call when somebody gets diagnosed, and I've met many families throughout the years afflicted with this disease, and I take it upon myself, and I treat them like they're my family. So I want to make sure that they have their resources. They know about the resources available to them. Now, let's say, like again, short and long-term disability insurance. I just touched on that. Some people have, well, I'll say a few people have long-term disability insurance because of the fact that we don't plan for the future. We're always going to be healthy. You know, we have that in mentality that we're going to live forever. That's great, but if you're...
It's also very expensive.
It is very expensive. It is.
More so today than 20 years ago.
Oh, yeah, definitely. Now, the one thing is, with insurance, life insurance, long and short-term disability plans, the younger you purchase it, the less expensive it is. But once you hit 50, you're going to be like, whoa, I don't think I can afford this. So that's why most people, when they go look for employment, they want, you know, the benefits that an employer can offer. And also, to be fair to the employer, employers want to offer, you know, reasonable benefits. But, you know, our situation at the moment, it's pretty hard, you know, to offer good benefits. But nonetheless, there are companies that offer them. So please take advantage of them. Myself, I mean, my health insurance went up a lot, so I won't say much, but it can be a whole labyrinth, and you'll get lost on the way. So always make sure you reach out to health insurance advocates that are willing to work with you. They might charge you a consultation fee. I do myself, but you know, it depends on on the case itself. But I do offer those services, and people do seek me out. And if we sit there and review for an hour or 3 hours, and I've done my job, then I kind of waive that consultation fee. I just want to make sure that I can get that word out there. Sometimes people are willing to, you know, refer me. So if I'm about referrals, I do run a business, an agency, but the fact is I'm true to my word as far as my passion goes. That's who I am, and I like to serve. Now, again, people afflicted with this illness, be it cancer, ALS, kidney failure, it's pretty hard. It's pretty hard to take. In my family, we've been affected with cancer, so I know personally what it takes out of a family, especially, you know, economically. We don't plan for that savings. We don't plan for, you know, for that surgery. It's something happens. So now I'm going to touch up on the supplement. Regular supplemental, like, let's say, for instance, Aflac. Aflac's a good company. Aflac offers great products. Something that's always offered most of the time, I'd have to say, about 80% of the time, small business owners and large offer supplemental insurance, such as Aflac. Take advantage of those. I offer and I sell it. And I personally have talked with the families, with my pals, and you might want to think about, you know, planning now instead of shuffling later on, 5, 10 years from now, and wow, I should have bought that policy. So it's just the matter of just sitting down and planning for those, events. Personally, I don't want any of these illnesses to come on to anyone. I want people to be understanding of basically there's a lot of resources out there for people as far as insurance goes. Supplemental is one key fact that you might not have health insurance, but you can have supplemental, like an accident plan. An accident plan, you can cover yourself or your whole family. It'll cover hospitalization. It'll cover for the injuries you sustained from an accident. So what I'm saying is it'll give you a benefit, a cash, a lump sum. In case you're diagnosed with a kidney failure, cancer, it gives you a lump sum. So if you have those benefits at work or been offered on a direct basis, sit down with that agent, sit down with that broker, and discuss your options. As far as affordability, they're affordable. We just gotta sometimes adjust our belt and think about insuring ourselves. We insure our cars, we insure our homes, but we never take the time to insure, the breadwinner, the children, things of that nature. So it's sometimes, I get, hey, Henry, you know what? That's a taboo. I don't want to touch my children. I don't want that. Well, the fact is, reality, we don't want anything to happen to our children. We want to make sure, at least in worst case scenario events, you want to make sure that you have some type of coverage, because normally most Americans don't have, $5,000-$10,000 tucked away just in case, and then that might not be enough. So take advantage of your benefits at work. Now, let's say Medicaid, Medi-Cal. Here in California, it's a state assistance fund that's out there for people in low income. So it's available to people. Every case is going to be different. So you want to look into, let's say, even if you have Medicare, you can apply for Medi-Cal. Those people are considered Medicare and Medi-Cal. So with that said, the state of California does offer, assistance for low income. Make an appointment, go down to your Medi-Cal office, and see if you can apply. Every case is different, but you never know. So that's something that you should look into. I don't want to go ahead.
So a lot of people think because they have assets, they can't qualify for Medi-Medi. We refer people to prior webcasts where if you get with an estate attorney who understands terminal illnesses and estate planning and insurance, that you can reorganize, oftentimes you can reorganize your estate with a trust and qualify for Medi-Medi as an individual. So it's just another thing to explore.
Definitely.
Ask questions. Don't assume because you have more than $2,000 in assets that you're not going to qualify. It's simply not correct.
Yeah, it's not correct. So you can always restructure your assets, put them aside, put them in a trust. The fact is, don't let that be a hinder to look into Medi-Cal, Medicaid. Everybody knows that here in California it's available, other states as well, but the fact is the state will take into consideration your assets. But again, talking to a professional, an attorney, you can restructure those assets. So I'll leave that alone right there.
And it's not smoke and mirrors. It's all
No,
legal.
it's not. The one fact is you want to make sure that, one, you're not breaking the law. Second, you want to make sure that you get the benefits that are there for you at that moment. Now, another thing is the Medigap. Going back to the Medicare, I know I've been bouncing around, but and I apologize. So the one thing is Medigap, Medicare supplement plans are, again, going back to the Part C, are insurance policies offered through insurance carriers where you can sign on to a Medigap or Medicare supplement plan and still keep your Medicare Part A and Part B. So again, when I said it's an 80-20 plan, Medicare, what Medigap does, it basically fills that gap in. So that 80-20 plan, you won't be responsible for that 20%. You'll basically have that Medigap policy in place. You'll have some share of cost, maybe a deductible or so, but it does help, and I do put most pals on a Medigap Medicare supplement plan because of the fact that those individuals will be using the hospital more so than others. They're going to be needing surgeries and whatnot. Maybe the whole protocol treatment with ALS, it's dependent, and every case is different. But the fact is, there is a higher premium when you have a Medigap Medicare supplement plan. So depending on your age, and when you qualify for Medicare, you want to make sure that you get into a Medicare supplement plan when you're offered Medicare, because you're guaranteed issue. That guaranteed issue means regardless of your pre-existing condition, the insurance carrier is going to take you in, give you that Medigap policy, and now you have your Medicare Part A and Part B. So let's say it could be $150, it could be $350. It all depends on the age. It's age banded. But once you reach 65 and over, it does stay around the realm of, and don't quote me on this, anywhere from 120, maybe 160. But when you're under 64, it is a little bit higher. So depending also on the insurance carrier that you select for your Medigap plan. Now,
But talk to me in terms that 80-20, that 20% can be huge numbers.
It can be
so
huge.
$300 a month is a bargain against the potential. I mean, just on a power chair, 20% could be $8,000.
Yeah.
That you've got to cover if you don't have the gap covered.
It's true. So that's what you want to do. You want to make sure that you sit down with a broker agent, or basically call the carrier. They know what they're talking. They know how to guide one. But the fact is, it's better on a one-to-one. And when people come to my office, or I go to their homes, I have all the information there. We discuss the options. But yeah, it could be a bargain. But then again, that premium tolerance is all dependent on each family. So each family's economic situation is going to be different. But nonetheless, I do put some pals on a Medigap plan because of the fact that it will outweigh the cost in the long run. Yeah, so definitely. Now, when you do have a Medigap, when you do have Medicare, you have to have a prescription drug plan, the Part D. The Part D is separate, so staying on the Medicare Part A and Part B along with Medigap, you need to have a Part D. It's not in, it doesn't come with the Medigap plan. So I'll touch on the Part C in a little bit. But prescription drug plans, you have to have a prescription drug plan. When you have Part A and Part B, you select the Part D, anywhere from, let's say, as far as price goes, anywhere from $19 up to $90. So again, Anthem, Blue Shield, let's see, Health Net, they all offer Part D plans. So the one fact is, you want to make sure that the medication, the formulary that you're going to be taking, the medication is on the formulary list. So again, that's another thing to take into consideration. But the Part C plans have the Part D already embedded in it. So those Part C, Medicare Advantage prescription drug plans, Part C plans, have everything from Part A to Part D. And then some ancillary products like chiropractic, dental, vision that Medicare doesn't offer. So it doesn't offer dental, it doesn't offer vision, doesn't offer chiropractic. Part C plans do from insurance carriers such as Aetna, Anthem, Humana, and whatnot. So you want to weigh the odds. So typically a person that's signing on to Medicare Part A and Part B. You know, hey, you know what? I just want, you know, the regular Part C plan. I'm healthy. I'm going to stick with, let's say, scan, for instance. So they stick with scan, and that has everything that that person's going to need. Might have a $3,800 max out of pocket for the year, but then it also has a deductible for the Part D medication. Now, when you have Part D implemented with your Part C plans, it's a co-insurance, so the carrier will always pay more. I believe it's an 80-20 plan, so it's in there. But the fact that, along going back to this example, a healthy male, he might just want to stick with that one plan and that's it, as opposed to a person diagnosed with ALS. You know, you might want to look at the Part C. How's the progression? Is it progressing rapidly? How do you know, what's the odds? Maybe a Medigap policy will suffice for now. But again, Medigap policies are a guaranteed issue when you're newly eligible to sign on to Medicare. So please take that into notice. Now, as far as let's see, what do we have here? Loan forgiveness. That basically you have to talk with. I don't know too much of it, and I won't, you know, talk into it. But again, talk to a tax professional. That way they can go ahead and assist you with that. Now, DME. Does my plan cover DME? Yes and no. So one thing is, Part C plans have that durable medical equipment coverage. You know, it could be a 20% you know, a share cost, but then again, that 20%, depending on the plan that you select, on a Part C plan I'm talking about, you will be out of pocket some, but not necessarily the whole thing. So remember that DME is covered under Medicare's Part A, B, and C. Now, another thing is, let's see, prescription questions. Let's say, again, going back to the Part C plans, yes, the Part C plans, the MAPD plans, they do cover prescription drug medication. Now, again, you're going to have a co-insurance. So once you start using your prescription drug medication, you're going to be if you're going to be paying, you know, the lesser of the amount until you reach what they call the donut hole. So let's say we're looking at the clock and you're going clockwise. So once you start from, you know, 1 to 12, and you throughout the months, let's say 9 months, you go ahead and you know, rack up about, you know, $3,800 worth of medication. Then you're going to fall into that donut hole. I don't know if many of you heard of a donut hole, but that donut hole means that basically just fill in that donut hole with another $1,750 or $1,850 out of your pocket, and then finally you fall into the catastrophic coverage, which now in turn you will pay anywhere from, let's say, for example, $275 to $5.50 for that medication. So now going back to the PALs do reach that donut hole quite rapidly within about 3 to 5 months because of the prescription medication they take. Now that's the part D embedded plans in the Part C. So again, the Part D is the same thing. The standalone Part D medication plans are the same. The only difference is, if you just want to stick with Medicare Part A and Part B, then you select the Part D, then you're golden. You don't have to go on to a Part C plan. But about 85% of Americans do select a Part C plan that has everything in place, as well as ancillary products like dental and vision and chiropractic and other benefits. So I hope I answered those questions. Now,
Henry, so I've gone through a long process to get diagnosed. I've probably been referred out of network, perhaps, either at my own expense or on an exception basis. So now I've connected with a neurologist I like, but he's out of network. So again, that's another thing to consider as I'm looking at open enrollment and possibly changing plans. Who do I want to work with? What's healthcare system, and do they take my insurance? Is it out of network? I mean, all these things are what you guys talk about and go over, right?
Yes, yes. Good question. Good question. So you want to make sure that when you select a Part C plan, or even your health insurance, your individual health insurance coverage, you want to make sure that you're within the network. See, the thing about carriers is they select certain hospitals to work with, and those doctors basically either will be taking Medicare assignment, or just they're going to be in the network of, let's say, Anthem Blue Cross. So we have an individual, and I'll use two examples: an individual with Medicare, an Anthem Part C plan. He will want to be in the network that Anthem has selected for that person that resides in, let's say, San Diego County. Let's say Scripps, for instance. Maybe Scripps. He only goes to Scripps. Or an individual says, you know what, I just want Kaiser. Okay, well, you just go to Kaiser. Kaiser offers those plans, not through a brokerage or an agency, but directly through Kaiser. So if people are like Kaiser, they can always call Kaiser, and Kaiser basically will sell them that Part C plan for those individuals on Medicare. Now, if it's an individual plan, again, same thing. You want to make sure you select a doctor that's within the network of that insurance carrier that they selected to work with. If you go out of network, you're going to be responsible for up to 50% of the cost. Now, to the question that Keith had mentioned, that say you like this doctor, but he doesn't take he's not in the network of Anthem. Well, that's when you have to sit and you have to discuss with the office, the administration, the office administrator, and hey, you know what, I really like this doctor. What plans do you take that I can be within the network? Then from there, talk to that administrator, and then from there, they'll tell you which plans they take and they work with.
And then can you protect yourself by putting your preferred physicians on the application? In other words, I've had a personal experience where we switched health plans with a specific goal to maintain a certain doctor, and after the switch, all of a sudden they said, "Oh no, we don't take them," you know. But since I had put it on the application, they literally let me back out and switch. Is that a 1 in a million shot, or?
That's like 1 in a million right there. I want the lottery numbers, Keith. You know what?
But it was very frustrating.
It
to go
is.
to the doctor's office on the 6th day of the new year and get turned away because the insurance we switched to didn't cover him when it was specifically on the application. Yeah.
Wow, it's discerning, because I mean, just a little tidbit about me. I've been in the industry 18 almost 19 years coming up in July. It's been a roller coaster ride for not just me, but every broker out there, every agent. We're always learning, or I'll call it continued education. But the fact is, I've been in this field long enough to know that insurance carriers are going to be sticklers. And I'm going to be maybe the first on record to say, insurance is like Las Vegas. The house never loses. Okay? The house never loses. But that 1 in a million shot, you know, hey, sometimes you get lucky. But the fact is, when you go to Las Vegas, if you got a good hand, a good dealer, hey, you know, things are good. But maybe I can be that dealer for everybody here, you know. I mean, the fact is, when you sit down with an insurance agent or a broker and they're glorifying an insurance policy or insurance benefit, run. Just run. Now, what everybody here needs to understand is to be on a sustainable product, one that you will be happy to have. I ain't going to guarantee it's going to be the best, but if it's working for you now and your due diligence has, put you into this path, then stick around with that agent, broker, or that insurance carrier, and they're willing to work with you. Now, the one thing is the squeaky wheel will get the oil. So always ask questions. If there's a grievance, file it. Insurance carriers will work with you. Now, I'm not anti-insurance. I'm pro, because I think everybody should have some type of insurance benefit as far as supplemental health insurance, life insurance. We need to really just stop and smell the roses, and if we have family, just think about our family, because the last thing you want is this event that you weren't expecting, and it puts everything in the wash. So that's a good question, Keith. Yeah. Now, as far as let's say,
So, yeah, I just jumped you to a new fact sheet.
yeah, see that.
What happens when I stop working?
What happens when you start working? Let's say as far as retiring.
Well, because I have.
Oh, ALS?
Yeah.
Yeah, so again, if you stop working because you have ALS, you're going to be basically qualified onto Medicare or basically the disability. You'll file for disability. Once you're on disability, once you're on disability for 24 months, then you're eligible for Medicare. Then you can apply for Part A and sign up for Part B. So, go ahead.
The 5 months in our case.
Yes, yeah. Excuse me, 5 months for the PALS, because you're fast tracked onto the Terry system, yeah. So yeah, I stand corrected. Thank you, Keith. So yes, disability kicks in, then you have your Medicare, and then from there, just try to sit with the family, discuss the options at hand, think about do I have short-term disability, any life insurance. What is my health insurance going to cost me? Because let's say you're on a good health insurance program through your employer, and all of a sudden, you get this thrown at you. So you want to say, well, you know what? It's costing me $300 a month, to cover myself and my spouse. But if I let go, it's going to cost me $1,000. So you want to use your benefits up to the point that they're going to cut you off, but the fact is they won't literally just take it away from you. You're going to be sent a COBRA package. What COBRA basically is the Continuous Omnibus Reconciliation Act. I hope I'm right. I might get it wrong. But the fact is COBRA is going to be offered to you, and instead of the employer paying 80, 70, 90% of your monthly premium for your health insurance, now you're going to take the full boat. So that
You have that option.
you have that option.
Right.
So some pals have in the past say, you know what, I'm willing to stick with this for another 3-6 months. Well, now, depending on the plan design, you can be on COBRA from 6 months up to 24 months. So it's all dependent on how it was structured and the employer presented it to the employees. So COBRA might be something that you might want to look into instead of going straight onto disability. But then again, you can file for disability as well. So that's a good question there. Yeah. Let's see.
I think you covered some of these others.
Yeah, I think I did. Yeah, 'cause like I said, again, I was jumping around. So
what should we be asking you that we didn't ask?
well,
What are the pitfalls and the things people run into?
you know what? The pitfalls that I've is and I mean this in a general sense. In the past 7-8 months that you've been referring me, I think I counted 17 cases that you sent me, and I gladly helped them out. The one thing that each individual on the phone has told me, I never planned for this, what do I do? So in general terms, what we need to do now is, what do we have as far as benefits? If we don't have any benefits, how can we apply for Medicare, Medicaid, Medi-Cal? Now, you have resources out there. You have friends and family. Always ask questions. And if you know somebody, such as Keith, or myself, give us a call, because we're willing to help you out. Again, ALS chapter here in San Diego has been, I'd have to say, a godsend, because not only the fact have I helped families out, but I do take it personal, and it has affected me to the point where it's really saddening, But there's this saying, people don't plan to fail; they fail to plan. So again, the pitfall is, if you are afflicted with this illness, or someone in your family, sit down and let's say what options are out there for us. Again, my family's been afflicted with cancer, so I have most of my family signed on to a cancer plan through Aflac, and in case of a diagnosis, there's going to be that lump sum that'll pay out. So little things that we take for granted, we should just kind of sit back and say, I think this guy's got a point, because I'm 52 years old, and if it's anything I know, I'm overinsured. Another thing that's really important, Keith, a health directive, last will and testament. You want to make sure that you have a will in place, testament, a trust, something to say that this is how I wish my estate to be handled. 80% of the people that I've seen in the past, just alone 5 years, had no idea. They don't have anything. Well, guess what? Probate. You don't want that. You want to get rid of that, because California's going to come. They're going to say, hey, come here. So the one fact is, sit down with the professional, read up on, trust. You want to protect your assets, put everything in a trust. I'm not the professional, but I can tell you, through my experience, and I've set up people personally, and it's a simple thing for me, but you might want to, if you have.
Yeah, we have two webinars previously addressing those issues and references. Yeah, we encourage people, both for their assets and their health, advanced directives, to get them in place, and to the extent that you're comfortable with, encourage you to share that with your loved ones. Saves a lot of drama, perhaps is the word, later, if it's not a secret. So
you want to make sure, if you have a life insurance policy, you have to let your spouse know, significant other, your children, because the insurance company isn't going to come looking for you.
No, they're not.
They're not going to look for you. They're going to say, hey, wait a minute, we haven't received the premium for this. It's been 2 years. Well, I know, joking aside, but the fact is, we need to provide those insurance policies in our will, in our trust, and
organize your
files. Basically organize. That way or your family knows what steps to take, if and when that time comes. So
how do we contact you? You want to give folks your
my number.
Information? We'll add it to the YouTube channel later.
Yeah, it's 619-204-5426.
One more time.
619-204-5426. That's my direct line. You can call me Monday through Sunday. I do have a life, but I don't do any social media. I'm more of a human touch kind of broker, so please feel free to call.
And Anything else?
Yeah, that's it for now.
So Henry, thank you much for coming.
Oh,
We
thank you,
appreciate
Keith.
it.
Thank you.
Appreciate you being there for our
Yeah.
pals and our families.
You're
and,
welcome.
You know, get advice. Talk to your HR if you're still engaged there and you're comfortable with that. Talk to somebody like Henry. Talk to your current broker. You know, ask the same questions and shake out the best advice. And like Henry said, if somebody's pushing something too hard, then you need to be a little skeptical and ask even tougher questions. So that concludes our webcast today on ALS insurance and benefits. We look forward to seeing everyone at the biggest support group meeting of the year, our Walk to Defeat ALS on Sunday, October 21st, Deanza Cove. The walk program kicks off at 9 o'clock. We hope you can get there a little early to enjoy each other's company and be supported. Thank you.
I'll be there.
Gotta go.
It's still live, right? Or you stop it?
No, it's still on. I'll kill it right now.
Okay.